I see people every day that want to lose weight, but then when you tell them they have to make changes to lose weight, that's where you get the pushback. And there really are stages of change, and most people come in the pre-contemplation phase where they want to make the change, but they don't actually want to physically make the changes to lose weight. And so there are different stages of change, and you really got to gauge where you are in that change and decide if you're ready. And if you're not ready, it's okay, but you need to acknowledge that it's not going to magically happen. There's different phases: pre-contemplation, contemplation, the planning phase, and that's another spot where we get stuck, and then actually making that change. It's really important to acknowledge that you're truly ready to make those changes for weight loss, because if you're not, you're gonna set yourself up for failure, and that doesn't feel good in the long run. So it's really important to be honest with yourself and recognize, am I in the pre-contemplation, or am I contemplating, or am I ready to plan and actually do something about it? And you may not be in that spot yet. You may be in a really stressful spot in your life, and maybe it's not a good time to do that. I've had many people, you know, they're going through a divorce, or they've had a parent that's passed away, and they say, I want to lose weight, and I say, you know what, I don't think you should worry about that right now. I think you should get through this, and we'll get to that in a few months when things are better, because it's very difficult for people. It's pretty stressful because it's a huge lifestyle change. And one of the things that you have to acknowledge is that you will make mistakes. There will be a day that you'll have a Twinkie when maybe you shouldn't have, and to not beat yourself up too much. But then if it happens, you need to look back on it and say, what could I have done differently, and learn from it. And like I said before, plan for the next time that you want that Twinkie and how you're going to respond. Plan for, I have hunger pains and I'm not, per my diet plan, not ready to eat for another 3 hours. What can I do? And have options out there to help yourself get through that. Because the thing in our country is that our weight issue is a lifestyle change. It's not a diet. I don't want people to go on a 3-month diet. I want them to make lifestyle changes that are better in the long run. I want you to think about what you're going to be eating in 10 years or 20 years or 30 years, and not just tomorrow. And in eating out, one of the big things that is a great tip is eating what you don't normally eat. So say your favorite meal is having a steak dinner, you can go to the steak restaurant with your family or your friends, but maybe order the fish instead. Might be healthier for you, but the bigger issue is you're going to eat less because it's not your favorite. The other thing that people do a lot, whether it's dessert or some of the buffet restaurants, is they order a big meal together. And when you have a big, huge plate that everybody shares from, you don't know exactly what you're eating, so it's important. So you don't really recognize how much you really are eating. So when you're eating out at restaurants as somebody on a diet, that's probably not a good idea. The other really big tip that people run into a lot is going to restaurants that serve chips or bread before your meal comes. And you probably need to send those back to the kitchen, because that's what people tend to do. They're starving, they tend to overeat on the chips and the bread, and then their meal comes and they eat all of that too. Just little things that you can do. One of the big things, once people have decided they are going to lose weight, is the planning phase. And in the planning phase, you really need to set realistic goals. A lot of people come in and they say, hey, I need to lose 150 pounds because they're morbidly obese. And that's great and that's fine, but it's not realistic. Let's start with 10 pounds and see how you do. Let's chop it up into little pieces that are realistic, because if you lose 1 pound a week, it's going to take you a long time and it can be very discouraging. So let's chop it up into little bits, 10 to 15 pounds. And as a physician, I think that's great, because they've shown just with a 10-pound weight loss, blood pressure gets lowered, cholesterol gets lowered, diabetes, blood sugars get lowered. So it doesn't necessarily take getting a model body to consider yourself healthy. So that's number one. Number two is deciding what you're going to do for diet and exercise. And what I tell folks initially is pick one. Let's start with one for the first couple weeks, because it's really hard to change your diet and to start exercising all at the same time. So let's pick one to start with, and then we'll get to the other one once you've been consistent about one or the other. Now, when you get into exercise, that's probably where people are the most unrealistic about what they're doing. You know, people think, oh, I need to go run 2 miles a day. And most people can't do that off the bat. I recommend people starting with walking, sometimes biking, sometimes swimming, whatever they can do to get moving. But walking's a really super easy thing for people to start with. And if people are out of shape, 5 minutes a day is really all they need to start with. I want it to be every day, but 5 minutes a day is really all people need to start with. increase it 5 minutes a week. So the next week it's 10 minutes a day. The next week it's 15 minutes a day. The week after that it's 20 minutes a day. But we're starting very slow and moving up slowly. That way there's no injury, because what tends to happen is people are really gung-ho about exercising. They want to do it and they go out and do something, they get through it, but their body just isn't ready to take it, and they end up getting knee problems or ankle problems or hip problems, and then they're not exercising at all. So I really want people to be realistic about where their starting point is, start there and move up slowly with the goal of getting to 30 to 60 minutes of exercise every day. Shawnee Mission Medical Center has a number of programs available to patients to help them achieve their weight loss goals. Probably the best starting point for anyone is online. We have a weight aware program, which will help you identify what your BMI is and where you're at in terms of your weight. We also have a number of year-long programs through our nutrition clinic, including the Weight Management University and the In Shape program. The other options out there is right now we have a Creation Health program that's available. That's 8 sessions that teaches people about lifestyle changes, and that's what I really love. Is it's not just a weight management program, but it's truly a lifestyle change to help you make something that can last a lifetime. I'm Sandra Archer, and I'm a family physician at Shawnee Mission Primary Care.